Well, this year, the issue, of course, highlighted due to the desperate need for trained medical staff to help us through the pandemic. Well, I'm joined now by Victor Khanyile of the Health Department in charge of Human Resources. Mr. Khanyile, thank you so much. Look, this is really welcome news. I'm sure you're just as relieved as everyone else, but tell us briefly, what is the plan and how did you sort things out?
No, thank you so much for the opportunity. Firstly, I would really appreciate and like to thank the commitment and basically the leadership from both the Minister of Finance and our Acting Minister of Health, and both the Director Generals in the both departments, who play quite a vital role in ensuring that, you know, us as administrators are able to can identify funding which will assist in terms of dealing with this shortfall that we have had for this media cycle allocation for medical doctors.
All right, so basically Treasury said, right, we're going to release the funds. Did it need this public outcry for Treasury to do the right thing? It sounds to me like you'd hit a brick wall in trying to sort this problem out, because this is not the first year. We've seen a number of years the same problem.
No, it was an outcry because I think the doctors, being desperate themselves, went to the public to actually cry out about this particular matter. However, we as the department were aware from April, and we have been communicating with them that we are engaging both provincial departments of health as well as National Treasury to sort out the problem. Yes, indeed, it might have delayed a bit because normally around June we are able to finalize, but this time we were delayed. I mean, it took us about 2 weeks in July to finalize the matter. But what is great news is that at least all of them are aware of where they have been allocated, and we expect them to start their employment contracts, I think the latest by Monday.
Can you guarantee this is not going to happen again next year?
As the Department of Health, we have put now in place mechanisms and also plans on how to deal with all medical interns that are to come from January this year. We have already commenced basically in ensuring that we get the projected number of all medical interns that are supposed to do internship from the institutions of higher learning. We are constantly engaging with them, and one matter is that these are people who are still going to sit for exams in December or between October and December. So it is a dual responsibility. They still have to ensure that they meet all the requirements by passing their exams. But us as the department, we have already set up mechanisms in place to make sure that we've got sufficient number of posts as well as the number of accredited and funded posts to make sure that they get this start date of the 1st of January, which is the next intake for medical internship in South Africa. And we acknowledge that that is the most, you know, stretched number that we take, unlike this media cycle. And we have already put mechanisms in place.
Is that a yes? It will never happen again?
Indeed, indeed. I mean, as I've already mentioned, that mechanisms have been put in place, but obviously they have to meet the requirements. And from our side, we have ensured that sufficient and adequate funding should be available on the 1st of January 2022.
Next intake. I've heard, I have been receiving messages from a number of pharmacists. We've done quite a few interviews about this problem, and the junior pharmacists are telling me they have the same problem. Can you clarify? Is this a problem for them too?
We have acknowledged during the media cycle that the number of demand for the positions was quite higher than what we normally intake as a media cycle. In our previous interviews, we've mentioned that the most sizable one is the 1st of January of each year, where we expect that everyone would pass between October and December and be able to take up a position. However, for this year, we've seen, due to COVID and other related reasons, which, I mean, students themselves are aware of, could not complete in December and had to carry a number of blocks. So our media cycle is mostly a cleanup one where we use people that are already in the system who are vacating posts to take them in. But this time, because of the actually larger numbers, we had to make arrangements to make sure that we open up more spaces. And normally, it is within or during a financial year, which you haven't made provision for it, because that, normally you take about 120 medical interns as well as about 40 to 45 pharmacists. But this time there were actually larger numbers, but we have made sure that we cater for all of them by being assisted through the National Treasury funding coffers.
That there were more pharmacists than usual because of the disruptions of COVID, so it was a little bit more challenging. So are you saying, sorry, and I just need a yes or no because I'm kind of out of time, the junior pharmacists who haven't been placed, have they also been sorted out now?
Yes, we have sorted out, according to our records, everyone who's eligible, who's applied on our system and has met all the requirements of being allocated for medical interns,
all right,
community doctors, as well as pharmacists, those that have been regarded as eligible by the Pharmacy Council of South Africa and have met all the requirements.
I understand, and thank you so much for clarifying that. That was Victor Khanyile of the Health Department telling us about the placement of junior doctors and pharmacists.